Hello, Nursing 403 nursing students. This is Carol Kruger. I'm your instructor for this term, and this is week 2 for this term. So first of all, thank you all for getting your homework done. I'm recording this on Monday, and I've put your homework up for review. So if you have questions or see something wrong on it, email me and I will go on the computer and look at it. You have a quiz tomorrow, and it is over chapters 1 and 2. We're going to be finishing chapter 2 today that we didn't do last week. Your quiz has been put onto my IoT. The quiz will be open for a while. There won't be a specific hour that you will need to take it, so I will give you an update by email. I do not know if all of your quizzes will be on my IoT or if just this particular one. So I just took it off of Socrative and put it on my IoT. Anyway, I will send out an email when it is ready for you to take. This video, which isn't exactly a video, but you can watch this anytime. It will be available. I will also be making some others on chapters that we will be covering this week. So this one will just be chapter 2 and kind of starting. We covered part of this, but I'm going to kind of go over it again. If you have any questions, like I say, email me at ckruger@iot.edu. So, community support systems, we talked about this. And remember, the page numbers aren't right from my PowerPoint. So, community support systems. One of the things they do is they look at patients or clients holistically. And I said that a few words that would be good to remember that separate this from case systems is the individual growth and movement towards independence. On community support systems, they typically include things like healthcare, housing, food, income support, rehabilitation, advocacy, and crisis response. So just about everything that a client would need. So remember about them fostering individual growth and movement towards independence. Community support systems. This is in your book, and you need to look at some examples of community services. We also went over this. So just to give you an idea, something like Meals on Wheels would be one of them that for some people would be good to know about, or things like WIC for a woman that has young children or is pregnant. Next one we come to is another one for community care settings. And this one is the case management system that is set up somewhat differently than the community support systems. So this one also is a holistic system of interventions, and it is to transition mentally ill clients into the community. I said that you really should look up psychosocial rehabilitation and what it is. Also, some of the other things that this one includes are consultations, resource linkage, which would also be referring perhaps a client for the best services that they might need, advocacy, therapy, and crisis intervention. So this one isn't quite as broad, it doesn't look like, as the community care. So we like to have the clients involved in all of this. So the focus on this would be prevention, maintenance, treatment, and rehabilitation of people with mental health care problems. So the overall goal of this care is a successfully functioning client who is able, with support, to avoid relapse and achieve productive patterns of living. So some of the things that we talked about before: psychosocial rehabilitation. On the PowerPoint there, I said, what is it? So psychosocial rehabilitation is going to help a client gain the skills they need to carry out the activities of daily living. We would like this to be them to be as active and independent as they can be. So whatever this would take could be designated as a part of psychosocial rehabilitation. Consultation is actually giving them the assistance of a specialist in whatever they need help with. Resource linkage, we talked about this before, and it is matching the client's needs to the most appropriate resources. Advocacy, helping the client have the information they need to make certain decisions. Therapy, this could include medications, counseling, support groups, or even vocational rehabilitation. And the last one, the crisis intervention. When we think of a crisis, we're thinking short term, and we're thinking active therapy. It is used to solve the immediate problem and restore their previous level of functioning for crisis intervention. So I did say that there was a table 2-2, and it talks about continuous intensive care management. And what they're meaning is intensive care, like intense care. And so one of the items that it talks about is the Assertive Community Treatment Team, also called ACT, and knowing that they may have to meet with the clients as often as 2 to 4 times a week. And this is to help them with crisis situations. When we talk about the multidisciplinary healthcare team, we're talking about professionals working within mental health system and the various backgrounds they have and what they help the client with. So hopefully the care team is going to provide quality client care. So we have some listed, such as psychiatrists, social workers, nurses, and others that are part of the team that develops care plans for the client. So some of the ones that I talked about that you should look up would be the psychiatric social worker, the expressive therapist, and the recreational therapist. Those 3 in particular, you may not know exactly what they do, and you can find this under mental health care members. These can be available in both inpatient and outpatient care. Have some pictures here of probably homeless mental patients. And another one here. So when we talk about mental disorders in the United States, we're not talking about necessarily a severe mental disorder. So 1 in 5 people, about 19%, close to 20%, 1 in 5. So this would mean mental or emotional disorder could be even something like mild depression or mild anxiety, but with a diagnosis. When we talk about high-risk patient or client populations, we're talking about people in the community that are at a high risk for developing mental health problems. We did look at some of these before when we were coming up with what are some risk factors, and we talked about life circumstances. We talked about the childhood nurturing. So when we talk about these people, they are more at risk in developing mental health problems than some others. For instance, homeless people, children, families, adolescents, and older adults, people who are HIV positive, clients who live in rural areas, mainly thinking that people that live in rural areas may not be able to get to a healthcare provider or have the resources perhaps available as somebody that lives in closer. So when we're looking at this, children, families, adolescents, older adults, this is a pretty large percentage of the population, actually, looking at it that way. Factors that affect mental health care. So we already said that at any time, there are about 19% of the adults in the US and about 7.5 million children that suffer from emotional and or mental disorders. Severe chronic disorders such as schizophrenia and depression are challenges to treatment. They can last many years, or some of them do actually last for a lifetime. So substance abuse, when we talk about it, some drug users or abusers of drugs are actually in a permanent psychotic state. They are really never in touch with reality. Some of the other things, Alzheimer's. Alzheimer's is a mental health disease, and they expect that Alzheimer's is going to increase by 300% in the next 15 years as America ages. We also know that about 12% of US citizens live below the poverty line, which is approximately 33 million people. Congress established the Health Care Financing Administration in 1983, and this was a cost containment method, which we use today. So when somebody is admitted to a hospital, they come up with a number of days that they need to be there for that particular illness or disorder. And if they are there longer, it is usually up to the hospital to pay the difference. So this is why there's usually a shorter time of stay on this. So the healthcare providers are paid on the average length of stay, and this is diagnosis-related groups, or DRGs. Social issues, when we talk about social issues, there are a large number of people in the United States that are unable to make a living. Homelessness, when we talk about homeless people, it means that they lack a regular and adequate nighttime dwelling. And about 85% of the homeless population suffers from addictions or mental disturbances. Many of them also have a lack of support systems, family dysfunction, poverty, poor health status. Even a small event can trigger a crisis. Many of them are addicted to drugs. So the patient-provider contact is the core of mental health treatment. Having people in contact with their provider, and hopefully the number of crises will come down, and hopefully some of the resources will be available to them. We have some questions coming up now. Marilyn is a 40-year-old Canadian citizen. She is eligible for all of the following except. Do we know the answer to this? I'm going to let you look at it and answer it. So for one of these, at 40 years old, she may not get. Question 2, Oliver is a British citizen. What type of healthcare system does his country use? So you might look at this. We know that they have very tight controls on their health system, and the money going out and the money coming in. Question 3, how are patients admitted to inpatient psychiatric care? This was the one that we looked at closely that had to do with do they need it? Do they have money to pay for it, etc. So see if you can come up with the answer on this one. Question 4, mental health services commonly are delivered by a or an. Would this be primary team approach? I don't know if we have used the word primary. Holistic healthcare focus. We have talked about holistic, multidisciplinary care team approach. We have talked about this, the different disciplines that are used to give actually holistic healthcare, or the individual team approach. Pick the best answer for that one. Question 5. Community mental health services serve all of the following except the homeless, children, clients with HIV/AIDS, elderly individuals. Seems like they're all served, but you can decide about that. That is the end. I will come up with another one later this week. Thank you. Email me with questions.